if there are just 50 of us from Kano, there are 44 local governments. If from each local government somebody will just build a health facility, that will mean additional 44 health centers in Kano. That will go a long way in reducing the burden on the government. And it will definitely improve the health position and situation of our population, especially those at the lower rank of the ladder.
Na yi tunanin gwamnati ce ma ta gina shi, to sai da na zo sai ake ce mai garin Hotoro shi ya gina wannan asibiti. Sakamakon area nan gaba ɗaya babu wani asibiti haka primary health care, to yanzu kuma gashi an samu asibitin da zai taimaka wa mutane ko da a ce irin abu ya samu mutum cikin gaggawa ko yan uwansa kafin su kai ga kai shi wani wajen za a iya kawo shi domin a ba shi taimakon gaggawa.
Gaskiya na ji farin ciki sosai saboda da mun tafi wata unguwa. To ta kawo mun samu a cikin unguwarmu dagacin mu mai kishi ya zo shi ya assasa wannan asibiti kuma ya miƙa wa gwamnati, ita ma kuma ta zo ta miƙa wa ya zama na kwamiti na 'yan unguwa kuma ma'aikata alhamdulillah.
Gaskiya na ji daɗi sosai, na masa addu'a cewar Allah ya saka masa da alkhairi.
Alhaji Yahaya Hotoro is currently the village head of Hotoron Arewa in Nasarawa local government of Kano state. But before becoming the village head, I worked in a bank and retired some 10-15 years ago after achieving the rank of an executive director. This community health center is about 6 years old now. 6 years. Well, the real motivating factor is like majority of the people, because of the economic situation, find it rather difficult to travel like some 4 or 5 kilometers to get medical attention. And I thought if you have a hospital or a facility located within the local community, that will make it more accessible and easier, and it will make the environment more attractive to the local people. There was a hospital, a health center, but as you know, Hotoro is a fast growing, should I say, town. Maybe with the insecurity in some parts of the northeast and the northwest, like a lot of people have migrated, and most of the people coming from the northeastern part settle around this axis, Hotoro Mariri axis. So the population has geometrically increased, and that has put a lot of pressure on the existing health facilities. And it is because of this increasing number of people that made me feel we need more than 2, 3 or more health facilities really in the neighborhood. So what we have is may not even just be enough, but is like starting from somewhere. The primary health care ordinarily should be the responsibility of local government, but that is the base. That's where the greater number of the people live, and a lot of them do not have access to these facilities. Either they don't have access because of economic hindrance or physical or locational hindrance. So if the primary health care is properly taken care of, I think 50% of the health challenges would be addressed, because a lot of the basic issues could be handled at that primary level. Issues like malaria, issues like diarrhea, issues, so some of these basic things can be treated at primary level. And one other important thing is even education, because the primary health care will give some higher level of awareness, particularly to pregnant women and things like that. So primary health care is the real cornerstone of the health sector. And if that level is properly addressed, funded, looked after, then the secondary and tertiary level will be less burdened. Like they say, if there is a will, there is a way. When the idea came, I have a piece of land which is strategically located. I just got my brother, who is a QS, not even an architect. He gave me a plan. I had contact at the Ministry of Health. I made some contact. They gave me some kind of model, what is required for a primary health care facility. And we looked at it. We realized our plot of land can accommodate those structures, and through direct labor we set out, we built it. When we are done, we went to the ministry, we informed them, they came. Fortunately or surprisingly, the ministry officials were very excited about the project. The commissioner, the pharmacist, they all came, they saw it. They gave us all the necessary advice. They there and then told us whatever assistance we need, they are ready. We said, of course, we need personnel. They wrote a letter to the Executive Council. They got the necessary approvals to come and take it over and manage it. At every level, they were very excited, as if it is the only primary health care center that is ever built and donated to the state. I mean, they gave it that special, how would I say, attention, that I was humbled by their response, honestly. So that was how it all started. And like they say, the rest is now history. Under 1 year. Yeah. Nothing negative seriously, rather than support and encouragement from the agencies. And from my experience, I will advise anybody who is interested to follow this route to just go ahead and do it. There are no serious challenges, but rather serious positive surprises, because the management of health in Kano in particular are very proactive, very friendly, and very business-like. They don't act with the usual lackluster attitude of public servants. They are really act like businessmen, and very passionate about seeing facilities built and developed. So whoever is interested really is a road to take. It's good, yes. So no negative challenges at all. Certainly it does. Because I even discovered like they have a system whereby they have staff who go around houses to like canvass, to tell them about the existence of the facility and the services that are rendered. So it's like the accessibility and the availability concept is really, really working there. So people have come to accept like, look, they can go to hospital and they can get service. Because maybe because of level of low knowledge or lack of it, people still can fall sick, and instead of going to hospitals, they try some local herbs and concoctions and what have you. So those women or staff that go around houses telling them about the existence of these services are helping to create awareness and to drive people away from local medicine or self-help to proper modern medical services. That in itself is something that is quite beneficial to the local community. When we finished, that's when we donated the project and everything to them. And they set up what they call community relations friends of the hospital. We send people who got trained. They have some bylaws about how community can participate in health, in management of health facilities. So there is a committee with a local person as the chairman, a lot of local people as members. There are even signatory to the accounts. So anytime they are ordering drugs or something, the chairman must sign. If there are issues or problems, mostly it is the local community that addresses those problems, those that can be addressed. But all the staff and personnel are posted by the ministry or the board or the health section of the local government, except some support staff like the security, like the cleaners. The community donate those ones. So we take care of the security, we take care of the cleaning, but professional staff are on the payroll of the state. Yes, that's the arrangement. So it is on the same pedestal with other health facilities. The only difference is like the community takes a closer look at the affairs because they feel they own it. It is their own facility. That's basically it. And from time to time we intervene. If a scanner or any of the machines is not working and it needs to be fixed, the amount is not huge, the community does it. Yes, so that's how it is run. Yes. Part of our motto really is, and that's what we used to tell all the in charge and the pharmacists, that we want it to be the facility of first choice. Ideally, we wish we can give these drugs for free, but because we cannot, we challenge them to say we want it to have the lowest prices compared to neighboring facilities wherever they are. So even if it is a service, whether for scanning, for whatever, if facility A is charging like 1,100, we will want our own facility to charge either 1,000 or 950, as long as they can break even. We want the best services at the lowest possible cost. That's just the objective. And we try to sell that to whoever comes to work in the facility, and to impress upon them that whatever assistance they need from us to achieve that, they should feel free to tell us, and we do assist them to ensure that they don't charge exorbitantly for services that can be charged something lower. I didn't tell you, we have an arrangement whereby we have, I wouldn't call them free drugs, but subsidized drugs. We have some some money, some deposit, whereby people who really cannot afford certain drugs can get them for free. But there are some conditions. It's either people that are known that they really cannot afford, or they have proved from their looks and what have you that they cannot pay. So they get those free drugs. So all those things, reports do come back that people do go and they enjoy those facilities and they are very appreciative. So those are the kind of moments that give me considerable joy, really. Our initial plan was not just to have a primary health facility that will look after like 100, 200 patients a day, was to have something bigger. That was the plan. But from the land that is left, that is available now, there is still room to expand. And inshallah, sooner or later, we'll put something close to what we have now, so that more and more patients can be attended to. It's just not enough you read it and you lament. Somebody somewhere should do something. And if people like me who are privileged to have gone to school, to have gotten maybe good jobs, to have even been in a position to buy those magazines and even read those reports, will do something, and there are hundreds of us around, then this problem will automatically be solved. There are hundreds of people like me who are privileged, who read those reports and who lament. But we only lament. Lamentation will not solve our problem. We have to do something. And the journey of 1,000 miles, like the Chinese proverb says, begins with a step. And I hope people will be inspired, people who are even bigger and wealthier than me, to do more. If I can do this small facility, some people will do 10, 15, 20 times that. And that will really, really go a long way in improving the health condition of our people. That is it.